Megan. My name is Shelby. I'm going to be your nurse today. I'm just going to be going over some of your medications with you, okay?
Okay.
So it looks like you're on acetaminophen, dextrose 5%, Fluzone, insulin aspart, duoneb nebulization,
Mhm.
Ativan, Protonix, Zosyn, Pneumovax, and vancomycin.
Okay.
The Protonix is new for you, right?
Right.
Okay, so I'm going to talk to you about your insulin and your Protonix, okay?
Okay.
So insulin aspart is also known as Novolog.
Yeah.
Um, it's an anti-diabetic and it's a rapid-acting insulin. So you'll want to make sure that you check your blood sugar before you even consider giving yourself this medication, okay?
Okay.
Um, so the doctor should have given you what is known as a sliding scale, and that's like a chart to tell you how much insulin to give yourself.
Yeah, he gave me one.
Okay, perfect. Um, so insulin is a subcutaneous injection, so that means it's going to just go below your skin. The best place to give it is either in your thighs, your stomach, or the back of your arm. But usually for self-administration, it's easiest to give it in your thigh or your tummy.
Okay.
So what you'll want to do is first you'll get a needle and you'll put it on your insulin pen, okay? Just like that.
Okay.
So you'll dial up 2 units and just inject it into the air.
Oh, okay.
And that's just to get whatever air may be in the pen out and to make sure that you're getting the full amount of insulin that you will need.
Okay. So just squirt it
Yep.
out there. Okay.
Yep. So then say you needed 2 units, you'll just dial it up and you'll clean your injection site. You'll pinch your skin and you'll
Okay.
just like that. Um, so you want to make sure that you switch injection sites. So say before breakfast you gave yourself insulin here, at lunch you'll want to give it here.
Okay. So I
Okay?
have to give it to myself every time that I eat?
Yes,
Okay.
before meals,
Okay.
if your sugar is high enough.
Okay.
Um, and then you you don't want to give yourself this medication if you will not be eating within about 5 to 10 minutes because it is such a rapid insulin.
Oh. Okay. I think I was giving it like 30 minutes before.
Okay.
So.
Yeah, you don't want to do that. Um, and you don't want to give it to yourself if your blood sugar is too low. And too low would be below 70 is usually when people experience hypoglycemia, so the low blood
Okay.
sugar. But your chart should tell you when to give it. It'll tell you when you start administering.
Okay.
Okay? So this pen can be stored at room temperature for up to 28 days, but don't expose it to excessive heat, sunlight, and don't freeze the
Okay.
pen, okay?
Yep.
For adverse effects, allergic reactions have happened to people before, but they're not common. I don't think we've ever experienced that with you.
No.
Okay. Um, and hypoglycemia and hypokalemia, which hypokalemia means low potassium levels, are common if you give yourself too much insulin.
Alright.
Um, and so you'll want to make sure you're watching for your hypoglycemic signs and symptoms. Do you know what those are?
Like when you get a headache or dizzy and sweaty,
Mhm.
maybe cold, that kind of thing?
Yep, perfect. Um, and you'll want to change your injection site to avoid injection site reactions.
Okay.
And as far as like drug interactions, I see that you're on vancomycin and Zosyn. These are both antibiotics, and other antibiotics as well can cause hypoglycemia. So you'll want to really monitor your blood sugar when you're on that and be in tune with your body. And then you're also on albuterol, which is your duoneb. This is a corticosteroid, and steroids enhance or increase your chances of hyperglycemia. So between these 3 medications, you'll really want to watch your blood sugars.
Okay.
Like I told you, it takes about 15 minutes to take effect, and you'll see the full effect within 1 to 3 hours.
Alright.
And then while you're on this medication, you should have a regular lab test done called the glycosylated hemoglobin. And this should be done every 3 months to monitor your treatment and control, and it'll tell us the average of your blood sugar over the last 3 months.
Okay.
Like I told you, you should eat immediately after injecting this medication because of its quick response. So, can you tell me why you're on this medication?
Since I'm diabetic.
And when will you use it?
Before meals.
And how are you going to use it?
Well, first I'm gonna check my blood
Mhm.
sugar and my sliding scale that the doctor gave me.
Mhm.
And then I'm gonna get a needle and put it on my pen. And then drop 2 units like that,
Mhm.
and then squirt it into the air. And then whatever my sliding scale says, I'm gonna drop that many units, like 2. And then I wanna clean my site and then pinch it
Mhm.
and then
Perfect.
inject the whole
Good
thing.
job.